understanding anxiety. 1. Define anxiety and its various forms, including generalized anxiety disorder, GADI, social anxiety disorder, and panic disorder. 2. Discuss common symptoms such as excessive worry, restlessness, irritability, and physical symptoms like increased heart rate and muscle tension. 3. Explain the difference between normal anxiety, which everyone experiences from time to time, and anxiety disorders, which can significantly impact daily life. 4. Explore the factors that contribute to anxiety, including genetic predisposition, brain chemistry, personality, and life experiences. Recognizing triggers. 1. Provide examples of common triggers for anxiety, such as stress at work or school, social situations, financial worries, health issues, and traumatic events. 2. Encourage readers to reflect on their own experiences and identify specific triggers that provoke anxiety for them personally. 3. Offer guidance on how to recognize physical, emotional, and behavioral signs of anxiety when triggered. 4. Discuss the importance of awareness and self-reflection in understanding the root causes of anxiety. Practicing mindfulness. 1. Define mindfulness as the practice of being present and fully engaged in the current moment without judgment. 2. Introduce mindfulness techniques such as deep breathing exercises, guided meditation, body scans, and mindful movement, e.g. yoga or tai chi. 3. Explain the scientific evidence supporting the benefits of mindfulness for reducing anxiety, stress, and depression. 4. Provide practical tips for integrating mindfulness into daily life, such as setting aside time for formal practice and incorporating mindfulness into everyday activities like eating and walking. Cognitive behavioral therapy, CBT. 1. Explain the principles of CBT, which focuses on identifying and changing negative thought patterns and behaviors that contribute to anxiety. 2. Describe common cognitive distortions such as catastrophizing, black and white thinking, and overgeneralization. 3. Provide examples of CBT techniques, including cognitive restructuring, thought challenging, and behavioral experiments. 4. Highlight the effectiveness of CBT in treating anxiety disorders and improving coping skills. Setting realistic goals. 1. Emphasize the importance of setting specific, achievable goals for managing anxiety. 2. Discuss the concept of SMART goals: specific, measurable, achievable, relevant, time-bound, and how to apply it to anxiety management. 3. Provide examples of short-term and long-term goals related to anxiety reduction, such as attending a social event without experiencing a panic attack or completing a relaxation exercise daily for a month. 4. Encourage readers to celebrate small victories and acknowledge progress, even if it's incremental. Building a support system. 1. Highlight the role of social support in managing anxiety and improving overall mental health. 2. Encourage readers to identify trusted friends, family members, or mentors whom they can turn to for support during difficult times. 3. Discuss the importance of professional support, such as therapy or counseling, for individuals with severe or persistent anxiety. 4. Provide resources for finding support groups or online communities where individuals can connect with others who understand their experiences. Establishing healthy habits. 1. Discuss the connection between physical health and mental well-being, particularly the impact of diet, exercise, and sleep on anxiety levels. 2. Provide practical tips for improving diet, such as reducing caffeine and sugar intake, and increasing consumption of whole foods, rich in nutrients. 3. Recommend regular exercise as a natural way to reduce anxiety and stress, with specific suggestions for incorporating physical activity into daily routines. 4. Stress the importance of prioritizing sleep and practicing good sleep hygiene habits to support overall mental and emotional resilience. Stress management techniques. 1. Define stress and its relationship to anxiety, noting that chronic stress can exacerbate symptoms of anxiety. 2. Offer a variety of stress management techniques, including time management strategies, relaxation exercises, and mindfulness practices. 3. Encourage readers to identify their unique stressors and experiment with different coping strategies to find what works best for them. 4. Highlight the importance of self-care and taking breaks to rest and recharge when feeling overwhelmed. Facing fears gradually. 1. Explain the concept of exposure therapy, which involves gradually facing feared situations or stimuli in a controlled manner. 2. Provide step-by-step instructions for creating a fear hierarchy and systematically exposing oneself to anxiety-provoking situations, starting with the least distressing and progressing to more challenging scenarios. 3. Offer encouragement and support for readers who may feel apprehensive about confronting their fears, emphasizing that exposure therapy is a proven and effective treatment for anxiety disorders. 10. Practicing self-care. 1. Define self-care as any activity that promotes physical, emotional, or psychological well-being. 2. Provide examples of self-care practices, such as engaging in hobbies and creative pursuits, spending time in nature, practicing relaxation techniques, and seeking social support. 3. Emphasize the importance of self-compassion and treating oneself with kindness and understanding, especially during times of heightened anxiety. 4. Encourage readers to prioritize self-care as an essential aspect of maintaining mental health and overall well-being. Acceptance and letting go. 1. Discuss the concept of acceptance in the context of anxiety management, emphasizing the importance of accepting one's thoughts, feelings, and bodily sensations without judgment or resistance. 2. Introduce mindfulness-based acceptance techniques, such as mindfulness-based stress reduction, MBSR, and acceptance and commitment therapy, AC, which teach individuals to cultivate a non-judgmental awareness of their experiences. 3. Encourage readers to practice letting go of the need for certainty and control, recognizing that uncertainty is a natural and unavoidable part of life. 4. Provide practical exercises and guided meditations to help readers cultivate acceptance and let go of unhelpful patterns of thinking and behavior. 12. Seeking professional help when needed. 1. Normalize the experience of seeking professional help for anxiety by emphasizing that it is a sign of strength, not weakness. 2. Provide information on different types of mental health professionals, including therapists, counselors, psychologists, and psychiatrists, and the services they offer. 3. Address common concerns and misconceptions about therapy, such as cost, time commitment, and stigma. 4. Offer guidance on how to find a qualified therapist or mental health provider and what to expect during the therapy process, including assessment, treatment planning, and ongoing support. Conclusion. 1. Summarize the key strategies for overcoming anxiety discussed in the article. 2. Encourage readers to take proactive steps towards managing their anxiety, knowing that they have the power to make positive changes in their lives. 3. Reiterate the importance of seeking help and support when needed, and remind readers that they are not alone in their journey towards greater mental health and well-being.